Sup guys, hope you're doing okay. Today we're gonna talk about depressive disorders. First, what is a depressive disorder? A depressive disorder is a very common psychiatric disorder that affects mood. These depressive disorders primarily manifest as profound sadness and psychomotor slowing, meaning the person moves and thinks more slowly than usual. These symptoms can seriously impact daily life, making simple tasks difficult to accomplish. Depression is a true public health problem. It is the leading cause of disability worldwide. In its most severe forms, it can endanger life, particularly due to the risk of suicide, which is particularly high in people suffering from severe depression. A depressive episode can occur in different contexts. It can be isolated depressive disorder, bipolar disorder, where depressive phases alternate with phases of excessive euphoria, or comorbidity with other psychiatric disorders like anxiety or addictions. This means that depression can often coexist with other mental or physical illnesses. Statistically, women are twice as affected by depression as men, and the diagnosis relies only on clinical findings, as there is no biological test to detect it. Depression in its clinical, typical form is characterized by a clinical triad. The first aspect is depressive mood, which manifests as intense, persistent, and uncontrollable sadness. This sadness invades all aspects of daily life, making it difficult to seek comfort or reasoning, and leads to functional incapacity, meaning the inability to perform usual tasks. In addition to this depressive mood, there are emotional disturbances. One of the most frequent is anhedonia, or the loss of pleasure in activities that the person previously enjoyed. There is also abulia, which is characterized by a lack of motivation or initiative, and in severe forms of depression, a complete loss of life drive. Sometimes the person feels emotionally empty, experiences constant boredom, and may even feel hypersensitive in their relationships with others, feeling easily hurt by trivial gestures or words. Other symptoms may include inexplicable crying spells, irritability, or feeling of intense moral pain. Depression also impacts thoughts. The person's experience typically becomes more pessimistic, with feelings of inferiority and excessive guilt. For example, the person blames themselves for everyday actions, even trivial ones, that previously would not have elicited any feelings of guilt. This picture is sometimes accompanied by suicidal thoughts, indicating a significant severity of the disorder. These are just some of the manifestations of a very heavy and complex mental state. Another major symptom of depression and a part of the clinical triad, psychomotor retardation, affecting thought, emotions, and behavior. It can manifest in several ways, starting with disturbances in the course of thought. Persons suffering from depression may experience bradyphrenia, which means a global slowing of thought. They are also often stuck in rumination, that is, repetitive and negative thought that can loop without any stop, making it difficult to get out of them. Sometimes the person may be completely focused on a negative thought. Cognitive alterations are also frequent. Concentration, memory, and attention become less effective, which can lead to constant indecision and a sense of perplexity, where the person no longer knows what to do, even for simple actions. On the motor and behavior level, there are bradykinesia, that is, a slowing of bodily movement, as well as bradyphasia, or abnormally slow speed. Other symptoms may include clinophilia, which is a constant desire to stay in bed, and anochoria, which is a complete lack of self-care. Sometimes a more extreme form of this psychomotor slowing can manifest as catatonia, which is a state of motor paralysis or a lack of response to external stimuli. However, it is important to note that agitation can sometimes occur, which is often linked to internal tension or anxiety, giving the impression of a contradiction with the usual immobility. The somatic symptoms of depression are often major reasons for consultation, as they affect the person at physical level and are visible externally. One of the most characteristic signs is poor mimicry, which results in a face marked by a frozen expression due to the sadness it conveys. This lack of expression reflects the inner state of the depressed person, often perceived as distant and withdrawn. Intrusive behaviors are also disturbed. Sleep is generally altered with marked insomnia, particularly in the morning, which is specific to melancholic depression. Sometimes excessive sleep, called hypersomnia, which can occur, but it is less frequent than insomnia. Eating can also be profoundly affected, with significant loss of appetite, or what we call anorexia, or conversely, episode of bulimia or bulimic attacks, especially in teenagers who may try to manage their stress impulsively by eating too much. Depression often leads to a decrease in libido and sometimes issues like erectile dysfunction, which adds a burden of guilt and worry to the individual. Somatic symptoms can also manifest as physical pain, such as headaches, back pain, heart palpitations, or diffuse itches, which is pain in different parts of the body. These symptoms do not always have an obvious physical cause, and paraclinical investigations like medical tests or exams often show no abnormalities. However, these symptoms respond well to antidepressant treatment, suggesting that they are related to depressive state and not to another pathology. Another almost constant symptom is asthenia, characterized by an extreme persistent fatigue, often more pronounced in the early part of the day. This feeling of lack of energy prevents the person from performing even the simplest task and contributes to isolation and worsening depression. Delusions occur within the context of depression. Although they are not systematic, they are often limited in time, meaning they only appear during the depressive episode. This type of delusion is generally linked with the person's emotional state, reflecting the same dark and negative feeling. For example, the person may have ideas of ruin, thinking they will lose everything, or hypochondriacal thoughts, believing they are seriously ill without any medical reason. The underlying mechanism of these delusions is primarily intuitive, meaning they do not rely on logical reasoning, but rather on emotions and irrational feelings amplified by depression. There are particular forms of depression, including less obvious variants but equally important to recognize. Let's start with this first form, which is masked depression. This form of depression is somewhat hidden, as it is primarily manifest through physical complaints rather than classic emotional symptoms. Individuals might complain of pain, intense fatigue, digestive issues, headaches, but these signs often appear to be related to another physical condition, which can lead to misdiagnosis, as the symptoms are not immediately associated with depression. Recurrent depressive disorder. This form involves episodes of depression that repeat over time. Individuals may experience periods of intense depression followed by periods of remission, but depression often returns. Sometimes these disorders might manifest as melancholia, which is a deep and severe depression, which in some cases could be linked to a more complex disorder, such as manic depressive psychosis, which is now called bipolar disorder, where periods of severe depression alternate with phases of excessive excitement. This is accompanied by all the symptomatic forms that can manifest in different ways depending on the underlying cause and triggering factors. Depression and organic conditions. About 4 out of 10 people with depression also suffer from physical illnesses. Depression might begin simultaneously with somatic illnesses, be linked to an existing condition, or even worsen certain disorders. Conditions such as Parkinson's disease, hypothyroidism, or hypercortisolism, or a high level of cortisol in the body can be associated with depression. Neurotic depression. This type of depression affects about 5 out of 10 people and is often called reactive depression or burnout. It is usually triggered by stressful life events such as grief, frustration, or conflict. Individuals with this depression might experience difficulties falling asleep, known as onset insomnia. Unlike melancholic individuals, they are more receptive to social support and often seek help when needed. The depression generally does not involve any delusional thoughts, and there is no break from a reality. Associated neurotic disorders may include OCD or obsessive-compulsive disorders, or some pathological mirroring. A final form, which is a melancholic depression. It is a very severe form of depression that affects about 1 in 10 people. This form of depression is characterized by an extremely severe major depressive episode with symptoms at their maximum intensity. The sadness becomes so profound that the person experiences intense moral pain that is difficult to alleviate. This sadness might be accompanied by total insomnia, resistant to usual treatments, and anorexia, leading to signs of dehydration and malnutrition. One of the most severe aspects of melancholic depression is the high suicide risk. Despite the patient's physical and mental exhaustion, the potential for suicide remains significant. In some cases, delusional thoughts may develop, such as feeling of worthlessness, incurability, or excessive guilt. The positive diagnosis of a major depressive episode in the context of characterized, meaning unipolar depressive disorder, is based on specific criteria established by the DSM-5. To make this diagnosis, it is necessary for there to be a break from the previous states and for the patient to present at least 5 of the following symptoms for a duration of at least 2 weeks. These symptoms include persistent depressive mood, anhedonia, which is a loss of interest in activities that were once enjoyable, changes in weight or appetite, appetite, insomnia or hypersomnia, agitation or psychomotor retardation, asthenia, devaluation or excessive guilt, or a constant feeling of inferiority, concentration difficulties or indecisions, suicidal thoughts, plans or attempts. In addition to the presence of these symptoms, they must cause clinically a significant distress or substantially impair social, professional or other crucial aspect of daily life. It is important to note that these symptoms should not be due to the side effect of any substance like alcohol or medications or any other general illness. The diagnosis also excludes other psychiatric disorders like schizoaffective disorder, schizophrenia, delusional or psychotic disorder. Finally, for this diagnosis to be made, there must never have been a manic or hypomanic episode in the past, which helps exclude bipolar disorder. Hope these information were helpful to you, and if you have any questions, no matter how it is, please ask them below. Thank you so much for watching, and I'll see you in the next video.